So this was the page where we left and we were talking about the muscles of mastication. Oh, sorry. Yes. So the muscles of mastication, these are all supplied by the mandibular branch of the trigeminal nerve, which is third branch. This is the temporalis, which is above the temporal bone, and this is the masseter, which is above the jaw, and this is the medial pterygoid. There is also lateral pterygoid which protrudes the jaw. You can see if this muscle will contract, the jaw will move in this direction, so it will protrude the jaw. So spinal nerves, there are 31 pair of spinal nerve, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. So the nerves, cranial nerve 1 and 2 7, exit above the corresponding vertebrae. This thing you should remember. Cranial nerve 1 to 7 exit above the corresponding vertebra. 3 exit above the third cervical vertebra. And this is very important when we will talk about the vertebral injury or stenosis of vertebral canal, from where these roots and nerves will exit. And the cranial nerve 8, spinal nerve exit below the cranial nerve 7 and above the T1. So you should remember this exception too. All other nerves exit below. For example, L2 exit below the second lumbar vertebra. So spinal cord lower extent means what is present in the lower extent. As we go down the spinal cord, what would change? So in adult, spinal cord ends at the lower border of L2 to L1 to L2 vertebra. Subarachnoid space, which contain the CSF, extend to the lower border of spinal sacral 2 vertebra. Lumbar puncture is usually performed between L3 and L4 or L4 to L5 level of the chorda equina to obtain sample of cranial cerebrospinal fluid while avoiding the spinal cord. To keep the cord alive, keep the spinal needle between L3 and L5. So needle passes through. These are the important structures. Number 1, skin. This is skin. Then the fat and fascia. Then the supraspinatus ligament. Then the interspinous ligament. Then the ligamentum flavum. At number 6, the epidural space. Epidural anesthesia needle stops here. And then the dura mater at 7th point. Then the arachnoid matter at 8th point. Then the subarachnoid space, which is number 9. And CSF is collected here. So you can see spinal cord ends here. So this is conus medullaris, and these are the nerve roots which will leave the vertebral corresponding vertebra, and these collectively are known as chorda equina. Chorda equina means it looks like a tail of some horse. So this end is called phylum terminalis, which is at the level of or between S2 to S3. So what is next?